If there's a coach or a player or a parent who's suspicious of that there's been a concussion, what are some of the initial steps that should be taken in terms of treatment on the sidelines?
One really good resource, I'll talk about that in a second, but one really good resource on this, the Center for Disease Control has a website, and they have a program called Heads Up on there. It has a bunch of resources on how to recognize concussions, what to do when a concussion happens. They have it for youth sports, for high school sports, for college sports, for men's, adult sports for concussion. But it's just, if a person has access to the internet, they should just go to the CDC website or type in CDC on Google and then Heads Up, and it'll pull up a bunch of really good information. So what should you do what should you do just practically if you think somebody's concussed? Well, the first step of any of this is if the person's knocked out, it's don't move the person. Make sure that there's somebody there who can help secure the person's airway in a safe way. They shouldn't be got up. Somebody should go out and assess their level of consciousness, go and see if they're still breathing, check their neck to see if they've broken their neck, and then once you get past that, the person got hit on the head and they're not knocked out. You want to remove them from the field of play. There's something called a standardized assessment of concussion, which is a card that you can also get at the CDC website. If a person finds a card maybe too much, the simplest thing to do are to ask them. There's these questions. There's a group of 5 questions called the Maddox questions. There's a doctor named Maddox who came up with these questions and found they're really a lot more sensitive for finding out if somebody's been concussed and asking them their age and who the president is and what the date is. People in medical areas always ask orientation questions. What's your name? What's the date? Where are you? They're not as sensitive as these questions. There's 5 of them. They're called Maddox questions. And the first question is, what venue are we at today? Next question is, which half is it? Next question is, who scored last in this game? Next question is, what team did you play last week? And the 5th one is, did your team win the last game? If a person misses any one of those questions, it's considered a sign that they had a concussion. They should just be held out of the game. It's a real easy list of 5 questions to ask. So I think that's a reasonable thing, that the person should be held out of the game. After they've been held out of the game, they shouldn't just be sent home alone. They should be sent home with parents or someone responsible for them who can keep an eye on them, because a concussion, the symptoms of a concussion aren't really specific to the problem of having just a concussion. You get hit on the head, you get nauseous, and you throw up. That doesn't mean you could just get that from a concussion. You could get that from other more serious problems. You could have ruptured an artery in your head or a vein in your head and been bleeding into your brain. And these people need to go to the emergency room right away and get a CAT scan to make sure that hasn't happened. If the person doesn't look right, it's an adolescent, as opposed to an adult adolescents maybe show their symptoms a little bit different than adults do, they should just simply to the emergency room and get a CAT scan. It's hard one to make a differentiation with, unless you're a doctor. I think it's better just to let the emergency room sort that out if you want to just make a broad generalization.
Yeah, I think you're right about that. The safest step is any doubt or any suspicion of it, just head to the emergency room.